What is Klinefelter syndrome's link to testicular cancer? Imagine a condition that affects how a man's body develops and how his cells grow. That's what Klinefelter syndrome is all about. It's a genetic condition where a male has an extra X chromosome, making his chromosome pattern 47XXY instead of the usual 46XY. This extra chromosome can cause the testes to develop abnormally, leading to lower testosterone levels and issues with sperm production. These testicular changes can sometimes be linked to an increased risk of certain types of cancers, especially germ cell tumors. But it's important to understand the details. Men with Klinefelter syndrome are about 19 times more likely than men without the condition to develop germ cell tumors. These tumors are a type of testicular cancer but are more often found outside the testes, in areas like the mediastinum, which is the space between the lungs. These extragonadal tumors are more common in adolescent males with Klinefelter syndrome. Interestingly, even though the testes are abnormal in Ks, studies show that the overall risk of developing testicular cancer in these men is not significantly higher than in the general population. This suggests that some genetic factors related to the extra X chromosome might actually offer some protective effect against testicular cancer, despite the testicular abnormalities. Klinefelter syndrome also causes testicular dysgenesis, meaning the testes don't develop normally. This can lead to issues like undescended testes, which is a known risk factor for testicular cancer. However, because the overall risk isn't much higher, routine screening for testicular cancer in Ks men isn't usually necessary unless there are symptoms or suspicious findings. The hormonal environment in Ks is also different, with lower testosterone levels. While testosterone replacement therapy is common to help with symptoms, it does not seem to increase the risk of testicular cancer. Instead, the hormonal changes in Ks influence the risk of other reproductive cancers, like male breast cancer, which is more common in men with Klinefelter syndrome. In addition to germ cell tumors, men with Ks are at increased risk for other cancers, such as non-Hodgkin lymphoma and male breast cancer. But overall, the chance of developing cancer in men with Ks isn't higher than in other men. It's just that the types of cancers they are more prone to are different. For men with Klinefelter syndrome, doctors usually focus on physical exams and watching for symptoms rather than routine imaging or blood tests for cancer unless something unusual appears. Being aware of the increased risk for extragonadal germ cell tumors, especially in the mediastinum, helps with early detection and treatment. To sum it up, Klinefelter syndrome is linked to a higher likelihood of certain germ cell tumors, especially outside the testes, rather than a broad increase in testicular cancer risk. The testicular abnormalities and hormonal imbalances in Ks contribute to this unique risk profile. If you or someone you know has Klinefelter syndrome, it's always best to discuss personalized screening and health monitoring with a healthcare professional. They can provide guidance tailored to individual health needs and help catch any issues early. Remember, understanding these risks helps in managing health proactively and ensuring the best possible outcomes.